Hello and welcome to the Zero to Finals podcast. My name is Tom, and in this episode, I'm going to be talking to you about osteosarcoma in children. And you can find written notes on this topic at zerotofinals.com/osteosarcoma or in the orthopedic section of the Zero to Finals pediatrics book. So let's get straight into it. Osteosarcoma is a type of bone cancer. It usually presents in adolescents and younger adults aged 10 to 20 years. The most common bone to be affected is the femur. Other common sites are the tibia and the humerus. So how does it present? The main presenting feature is persistent bone pain, particularly worse at night time. This may disturb or wake them from sleep. Other symptoms that may be present include bone swelling, a palpable mass, and restricted joint movements. Let's talk about establishing the diagnosis. The NICE guidelines recommend a very urgent direct access X-ray within 48 hours for children presenting with unexplained bone pain or swelling. If the X-ray suggests possible sarcoma, they need very urgent specialist assessment within 48 hours. X-rays show a poorly defined lesion in the bone with destruction of the normal bone and a fluffy appearance. There will be a periosteal reaction, which is irritation of the lining of the bone, that is classically described as a sunburst appearance. There can be an associated soft tissue mass also seen on the X-ray. Blood tests may show a raised alkaline phosphatase or ALP. Further investigations that are used to better define the lesion and the stage of the cancer are a CT scan, MRI scan, bone scan, PET scan, and bone biopsy. Finally, let's talk about management. Management involves surgical resection of the lesion, often with a limb amputation. Adjuvant chemotherapy is used alongside the surgery to improve outcomes. Patients will require support and input from the multidisciplinary team in addition to treatment of the tumour, and this will include pediatric oncologists and surgeons, specialist nurses, physiotherapists, occupational therapists, psychologists, dietitians, prosthetics and orthotics, and social services. The main complications are pathological bone fractures and metastasis. Thanks for listening to this episode on osteosarcoma. A big thank you as always to Harry Watchman for perfectly editing the podcast. You can find written notes on all the podcast topics in the Zero to Finals books available on Amazon. And you can find full audiobook versions of the Zero to Finals books on Audible. And you can find all the notes as well as videos, illustrations, and questions completely free on the Zero to Finals website at zerotofinals.com. And I hope you tune in for the next episode, which will be on talipes.